headquarters. Why is India so angry with its doctors? Are they really to blame? Are they really so negligent? That's the big debate on the other side of this report.
Dr. Dalwai has been opened.
I'm very impressed with Mr. Pandey's exposition of the population and Bangladeshis causing doctors to be beaten up in India. Congratulations. I'm very impressed with your creativity. But I have a question to ask. I'm a citizen of India. The Constitution of India confirms or assures me a right to life and a right to health. And it is a duty of the government to ensure that the Constitution is being applied appropriately. In terms of right to life and right to health, it's the government's job to ensure that everybody gets it by creating systems good enough for good health and for long life. That includes everything from infrastructure to pollution to controlling the hygiene around, to controlling the spread of malaria, to having good hospitals, to having well-staffed and well-equipped hospitals, and to have well-equipped and well-trained doctors inside it. So the doctors, let me tell all my countrymen, are a small cog in the wheel. They are a small cog in the wheel. Unfortunately, we feel, and the government very smartly plays in a play, that whenever the relative is aggrieved, and I agree and I understand that it will be agreed, the entire onus is shifted only to this small cog in the wheel who has absolutely no locus standi in the administration or the powers that be. And it's very smart of the government of the day, whichever party it may have been in power, to put this doctor up to face the crowd, ire of the crowd. But what it really means, it's a blatant failure of the government to provide what is enshrined in the Constitution, that is the health and life of citizens. And to cover up this massive failure of the national health policy or whatever it should be, it's the doctors who are facing the brunt of it. All the reasons given by our esteemed panelists are absolutely right. But the reason is the government plays into this and puts the doctor up to get beaten up. The resident doctor, the junior doctor, who's worked for the last 36 hours without having a meal, without having had any sleep, and is still there on the floor. And if these resident doctors were to go off, mind you, if the resident doctors were to go off, the public health system of this country would collapse. Yes. Which is why whenever they go on strike is the time anybody takes attention about it. So let's be very clear, it's the duty of the government, and the Constitution makes it mandatory to the government to provide health to the people of this country. The doctors are a small cog in the wheel. They have no right to decide how many doctors should be hired. You're talking about JJ Hospital, please go and find out how many doctors are on duty and how many patients are in the ward. You look at the pediatric wards, look at the ICUs. What is the staff strength of nurses? What are the drugs available? What are the medicines available? Does the doctor order for this? Does the doctor buy the medicines? Does the doctor is responsible for arranging all this? It's very clear who's at fault here, and it's very clear who's being beaten up for it.
Almost lack of blood.
You know, it's very easy and it's wishful to say that we hope that the society has better respect for the doctors.
Mr. Pandey, I'm coming to you only. I'm coming to you. Just let Dr. Dalwai make his point.
Yeah,
and you
it's
can
very
respond.
wishful to say that society should have a respect for doctors. Try saying that to somebody who just lost a relative in front of his eyes because there was no oxygen in the hospital. Now, does that ring a bell about what happened a few months back? And Mirror now ran a big campaign against it. At Gorakhpur, what happened when children died because the oxygen supply ran out? How many district collectors have been implicated?
And nobody
How
has
many
been
hospital
punished.
administrators have been implicated?
And nobody has been
Has
punished
anybody
till
been
now.
arrested? Has the chief minister been indicted? Not at all. There's no question about all this. And what do we have? We have doctors from India who pass out in India, study in India, go to UK, United Kingdom, and then turn out to be the best doctors there. And our Prime Minister goes to UK, he has to give a speech about corruption in India, and he uses this example of doctors going on trips to Singapore to denigrate doctors and to insult doctors, and as a head of state, he puts doctors in such a terribly bad position in the eyes of people. In a country where he has gone to London, where doctors from India have gone to UK and are literally running the NHS.
No, but
how does it, what impression does it create in the minds of the Indian people here? If the head of state is going to insult the doctors for no rhyme or reason. And coming back to what Mr. Sriram said about bringing in a good system. Well, one second, let me complete the private medical system. I agree with you. There are many bad sheep or black sheep. Let me complete. I'm not done yet. There are many black sheep in the medical profession. I agree. The way to put down these black sheep is for the government to get its act together, for the government to improve its government hospitals and improve the services in government hospitals so much that nobody wants to go to this black sheep in private practice. Why doesn't the government do that? You have all the infrastructure, you have the KEM hospital, you have the AIMS, you have the Sayan Nair JJ hospital in Bombay. Why don't you improve the infrastructure so well that no patient wants to go to a private hospital
No,
and pay
that
money.
point is completely
That's the best
taken.
way to put the private doctors
Dr.
in their
Dalwai, I
place.
completely agree with you there. It is because of the abysmal infrastructure, the
Absolutely.
abysmal backup that they have, that nobody wants to go into the government hospitals, especially after they've
That's the
spent
best way to put
years
down the black sheep in the private
so much
practice.
money and so much effort into getting that doctor's degree. That is largely the problem. We don't have enough security in terms of policemen versus the citizens ratio. That's as ghastly and disturbing as our patient to doctor ratio is.
Can I just come in?
Yes.
Yeah. There's the
Each
very simple what to do
needs
immediately.
to have security.
No, I agree with you. Absolutely. The doctors need to have security, but yes, Dr.
There's
Dalwai.
something much better than we can do than just increasing the security and make the hospital like prisons or mantralayas, which are well guarded, if I may say so.
Yes.
The simple thing is increase the salaries you pay the doctors, the paramedical people, the administration, the staff in the hospitals. Make sure all the medications which are available in private for a price are available in the government hospitals for a price paid by the government. In short, what you are saying, increase the health spending. This government has decreased the health spending on schemes like malnutrition. Increase the salaries of doctors, increase the facilities. The doctors will not go to a private practice. Ask me, all my juniors are worried about starting their practice in the private sector because they cannot even imagine coping up with bigger hospitals. At the same time, they cannot imagine joining a government hospitals. Just increase the public spending in public hospitals, public health. Good doctors will flock there, and so will patients flock there.
1.2% of our GDP is spent on public health care versus at least 4% which is needed. The government is looking at a national health scheme which would, we still don't know what the final details are and how long, 1 year, 2 year, how long it's going to take to even bring
Instead of building statues and various other things, let's spend money on the public health system.
Absolutely. Well said, Dr. Dalwai. Okay, Dr. Dalwai, I need to wrap up, but 30 seconds to you. Yes.
Just like to come back, you said about the wrong leg or the wrong part of the body being operated. There's a book by, again, an Indian surgeon, Dr. Atul Gawande, which is called the Checklist Manifesto. He is a surgeon, an Indian guy. He's a surgeon in US, in Boston, if I'm not mistaken. And he's written a book about medical science, and this book is called the Checklist Manifesto. And he describes in the United States the number of incidents where there was negligence, partly due to the fact that proper care was not taken. And the simple introduction of something like a checklist has brought down these incidences of negligence in the American medical fraternity by a huge number. What it means is every profession needs to get more and more professional as it advances. And there are various techniques or various professional new factors that can be brought into even the Indian health system. But for that, we need the infrastructure. We need doctors to focus on medical practice, on the science. There have been times when we have been spending our time getting food for the patient in the ward because there's just nothing for him. We've been spending our money to get medicines for the patients.
Yes.
So we need to create a system for Indian doctors in India where they can really function as well as they're allowed to be functioning in other countries. I think that's when we'll really have the strength and magic of Indian medical fraternity in India.
Right.